So, Dr. Scholz, today I would like to talk about focal therapy. So can you speak to who is eligible for focal therapy?
Well, the goal of focal therapy is to preserve usually sexual function. A lot of the standard treatments now with radiation are very good at sidestepping rectal and urinary problems, but there's still a risk of erectile dysfunction. So if someone has a prostate cancer that's on one side of the gland and the other side of the gland is clear, then it's reasonable to consider just treating half the prostate. When I say it's reasonable, of course, that's kind of a common sense recommendation, but actually it's pretty much not standard. Historically, to be safe and make sure that all the cancer is covered, either surgery or radiation targets the whole prostate. But now with better imaging and accurate biopsies and all these sorts of things, we can be pretty confident that there's no cancer on the other side. And of course, the question arises, why not treat half the gland or less than half of the gland and give men a better chance of not losing their sexual function? So it really comes down to that. It's got to be on one side of the gland if you're going to talk about doing focal therapy.
So it being on one side of the gland, that means that it cannot have metastasized, there can't be lymph node involvement, it needs to be localized prostate cancer.
Yeah, the people that have metastatic disease, we're not usually trying to cure them, and so they're usually off the table for these sorts of discussions. But the idea of curable disease could include men with even high-risk disease if it's a small area. Now especially we have these PSMA PET scans that can confirm that there's no metastatic disease. So the whole field is evolving quickly due to all these new and better technologies, better imaging technologies that allow us to use treatments that aren't as vigorous as what were required in the past.
So is this like a new form of treatment? Is this like a newer thought process, or has this been around for quite some time?
Well, it's becoming more popular. It's been around for a while. The people that were good at imaging, like Dr. Duke Bond up in Ventura, who's an interventional radiologist who has been doing focal cryotherapy for many years. But it's picked up momentum. Doctors who do HIFU, electroporation, they have talked about treating sections of the gland for up to 10 years now. But it has become more and more popular as the imaging has gotten better and as the awareness that this type of approach is available.
So we've talked about sexual function. How does it affect urinary function?
Sure. The risk of urinary problems should be even less since they're trying to steer away from the urinary passage in the prostate, the urethra. But even the standard treatments with modern radiation are affecting urinary problems at a fairly low level already.
Have you ever seen focal therapy done when there's seminal vesicle invasion?
Yes, occasionally. It's a bit unorthodox because we're worried with seminal vesicle invasion about the possibility of microscopic metastasis, and many of these men are on hormone therapy. But modern prostate care is becoming more and more customized. And on the one hand, you want to minimize toxicity and shrink the area of treatment to make the treatment more tolerable. But there may be a little higher risk of relapse. And so each individual patient has to have an extensive discussion with their physician in terms of what kind of risks am I comfortable with taking. This idea of a one-size-fits-all for everybody is kind of ridiculous when we've got all this flexibility now.
So if you do have a case where the tumor's on one side, there is seminal vesicle invasion, you're going to choose focal therapy, and you see that seminal vesicle invasion, have you seen doctors put men on like low-dose hormone therapy in case they have concern for microscopic metastasis, or is that not a common combination?
Well, with high risk, that's a high-risk prostate cancer, so it's even more unorthodox to be thinking about doing focal therapy in men with high-risk disease. That would be something that some patient would sort of have to stipulate that they want this type of treatment because for the most part, when you're dealing with high-risk prostate cancer, you want to do your utmost to cure it.
So there are multiple types of treatments that you can do focal therapy with. Can you discuss what you think are kind of the best and others you may have concerns about?
I don't necessarily think that any one type of treatment is better than any other type of treatment. It's much more important to have a doctor who knows how to use that treatment, that is good with imaging, that has a lot of experience We're talking about high-intensity focused ultrasound, electroporation, cryotherapy, and even radiation can be given to a section of the prostate. All of these approaches are reasonable. They're all effective at destroying tumors. And the issue for me is, how good is the doctor behind the treatment? And can that doctor deliver the kind of accuracy that's necessary with this sort of treatment?
So the next question I have is, PSMA is rising in its popularity. We're seeing a lot of clinical trials come in. But does normal focal therapy nowadays just kind of come in with multiparametric MRI? So they're really using 3T MRI to kind of tell where those tumors are localized?
Pretty much. The PSMA scans are, as they're being utilized, and this is evolving so quickly, it's a brand new technology, but typically for the high-risk patients, and that's those types of patients are not getting focal therapy as commonly as patients with intermediate risk disease. So yes, I'd say the primary imaging modality that has accelerated the use of focal therapy has been 3T multiparametric MRI, and that is, I think, has been the game changer. It allows doctors to be pretty confident that there's no cancer on the other side, and gives a clear picture of where the tumor is so that the focal therapist can direct his treatment right at the tumor.
So that's something we've talked about a lot on this channel, is really about the importance of having an experienced physician who has done these procedures. So can you give the audience some maybe questions that they can ask the doctors that they're interviewing, maybe a medical oncologist or someone, in order to kind of see what their experience level is?
This is one of the most difficult areas. And of course, I think there's a real advantage if you find a physician that has dedicated their whole life to doing one type of a treatment. And is doing that over and over and is a leading doctor. That, I think, is important to seek out. I think the idea of just going to the hospital and whoever gets assigned to you is a risky way to choose a doctor. I think patients need to be willing to travel outside of their city or state and go look for the number one person. This type of treatment, you get a chance at getting it right the first time. And if you have someone that's doing the same thing over and over again, you're much more likely to get a result that's going to be satisfactory.
Hey everyone, thank you so much for watching today. If you would go ahead and subscribe to our YouTube channel, that helps us promote our videos across the YouTube platform. And if you consider donating, that will also help us disseminate information to thousands of prostate cancer patients all around the world. The link is in the description below. If you need more information about prostate cancer, you can go ahead and visit our website, PCRI.org, and I hope you have a great week.